This healthy living tip is brought to you by the Christ Hospital Health Network.
Heart valve disease is any dysfunction of the heart valve that makes it either leaky or stiff so that it restricts or narrows the pathway for blood flow and causes pressure to build up, almost like pinching a garden hose. You can get the idea that pressure builds up proximal to where you're pinching it. If you have a valve that's narrowed, the same thing happens. The pressure goes backwards and can build up in the lungs, causing shortness of breath, cough, have trouble sleeping at night, have to sit up in a chair. And if it's leaky, instead of the orderly fashion going forward of blood, some of the blood when the heart pumps will go backwards. If more blood is going backwards and forwards, the body gets fatigued, muscle fatigue, and generalized nonspecific symptoms like fatigue, malaise, chest discomfort, and at times lightheadedness, and often palpitations, flip-flop, irregularity of the heartbeat. First and foremost, you need a good physical exam. Most physicians, particularly cardiovascular physicians, can tell with a stethoscope, get a pretty good idea as to what valve is malfunctioning and whether it's severe or not severe just by listening. Then we're fortunate because the echocardiogram or sound wave test has become a real gold standard for documenting not only the presence but the severity of valve dysfunction, both leakiness and narrowing, either one. Once the valvular heart disease is diagnosed, the decision has to be made as to whether the valve dysfunction is leading to irreparable injury to the heart muscle. In that situation, usually the valve must be replaced or repaired. If it can be temporized, there are medicines that can reduce the wear and tear or stress on the valve and nurse the patient along for years even on medications on occasion. Once those become inadequate, then traditionally surgery has been the treatment of choice for both leaky valves and narrowed valves. But recently there have been catheter-based technologies, and these are similar to what's done with an angioplasty when you put a tube in the artery, it comes up to the heart, where we can either replace the aortic valve with a valve that's actually delivered by the catheter, so you don't have open heart surgery, you don't have a bypass pump, the blood's not circulated through a machine, or repairing the mitral valve. There's several techniques for that, either clipping or tucking, if you will, the mitral valve to reduce its leakiness. I think the Christ Hospital can offer you the leading edge, really, similar to any top place in the country, access to new technologies to treat valvular heart disease. And this includes catheter-based technologies. We are invested in your health and welfare. We want to make sure that you continue to improve. And we're doing these procedures or making these changes, these treatments, with the intent of your living longer and better. And that's our firm commitment. Well, the Christ Hospital and the Lindner Center for Research and Education at Christ Hospital, which has been the vehicle through which all of these novel cardiovascular technologies have come, we're very excited. I'm excited to be part of that, and I think you wait. In the next year, there are more exciting technologies on the immediate horizon for the treatment of cardiovascular disease. And we are very happy to be able to bring these to Cincinnati.
For an appointment with a heart valve physician, call 206-1167.